Dear Oprah, how is Stedman? I am fine. I loved your interview with Fabio. It was fun. Hey, Dr. Frank Barone of Evolv Plastic Surgery and Medical Aesthetics.
Is everything okay?
Everything is great. I'm just catching up on some emails right now.
Did you get a haircut recently?
I did, yes. Why?
Just wondering, it looks like you're getting a little thinning up there.
Oh, I've noticed that.
Well, you know, we have something that might be able to help.
Really? Is it here in the office?
Oh, yes. Would you like to see?
Yeah, let's go see it. Oh, back at the telestrator.
Yes. Our little friend, the hair follicle.
I remember this, yeah.
Hair loss affects the majority of men and many women after menopause or as they get older, and it's a huge issue and affects people's quality of life. So what's going on is, as we age, either we inherit the tendency to lose hair or circulating hormones help cause that, but the follicle that makes the hair shaft starts to basically slowly die, which occurs over many, many years. This treatment that you'll be seeing today encourages the release of oxygen in higher dosing, opens up the follicles, opens up the skin, so you can deliver nutrients to the hair for the topical treatment, which is basically painless and can encourage hair growth over long periods of time. Much better than using chemicals like just Rogaine or minoxidil that's so common. And here's a patient who had the new CryoTouch therapy program, which is a 12-week program of taking an oral supplement and a once-a-day home treatment, topical. And then in the office, you're getting a cryotherapy with topical treatment. And as long as you have follicles, you can stimulate growth. And if you'll watch, this is a gentleman who had a 12-week course. He has sustained growth, thicker hair follicles, and more dense hair after 12 weeks of treatment. And this can be sustained over a long period of time. So we're very excited about this because it's a painless, no downtime treatment in the office, and then the patient has a home program with an oral supplement. This is all based by research out of the University of Chicago that shows you can inhibit the effects of hormonal hair loss as well as aging and actually grow the hair back.
All right, sign me up. Are you doing this alone today?
Actually, for you, we have a specialist.
Oh, that's great. Oh,
It's Amy.
Oh, Amy. Oh,
Amy.
Amy. Amy? I'm not mad at you, Amy. I just was not expecting that right there at that moment. Amy, put that down. Oh, Amy.
So this is the CryoTouch device, and this is going to deliver cold therapy, cryotherapy, and the high dose of carbon dioxide that is going to release more oxygen into the scalp for the hair follicle and also open up the skin so the medications can penetrate better. So this is the Trichocyte Booster, a research-based product that has these plant substances that will be driven into the skin by the cryotherapy device with the carboxyhemoglobin.
But there's no needles here.
No needles.
Okay.
It's strictly a topical treatment that's actually quite pleasant. And this is called the Bohr effect. So the Bohr effect means with the carbon dioxide, you're going to release more oxygen into your scalp. And as you're doing it, this will be delivered into the deeper layers of the skin where the hair follicle is. So the real challenge with delivering products for hair growth is getting the product deep enough because the hair follicle is on the underlayer of the skin. So with the cryotherapy, opening up the skin and the scalp and dilating the blood vessels with more oxygen, this is able to deliver high doses of these plant-based products right to the follicle. That's why it gets such a sustained effect.
Okay, so I've seen those where they take hair from one place and put it. This is a little bit different, quite obviously.
Yes, that's hair transplantation or hair grafts, and that's done where someone has lost all their hair and there are no viable follicles left. And that's an effective treatment, but it's surgical and very expensive. If you act earlier and with prevention, when the hair starts to thin, this is ideal.
Oh, is the scalp massage included?
Yeah, it's the best part.
Amy, my opinion of you has changed. Dr. Barone, usually I have to get going, but I think this time I'm going to stay. Thank you.
Stay as long as you want, just turn the lights off when you leave.
No problem. My name's Eric Albert, and this is another 13 ABC Marketplace Expert Edition. Amy, you're doing a wonderful job.